The symptoms of COVID-19 are well known and include fever, dry cough, fatigue, body aches, and more. However, there are people especially over 50 years that continue to suffer even after the initial COVID symptoms subside. They are called long haulers and the symptoms may linger for longer than 12 weeks. Before watching the video, kindly subscribe and click that bell button to inform you every time I upload a new video. If you are already a subscriber, thank you. Let's get back to those symptoms that might indicate you are a long hauler and indeed got infected with COVID-19. 1. You may have a multisystem problem. Multisystem means affecting many parts of the body including the brain, gut and heart. Long haulers have suffered neurological issues like confusion, delirium and hallucinations, vomiting, diarrhea and loss of appetite. Some have even spoken of blood clots. 2. You might have respiratory symptoms. Respiratory symptoms such as cough and shortness of breath are one of those sure signs of COVID-19. In long haulers, these symptoms keep showing up over a prolonged period of time. 3. You might have fatigue and headaches. Seen alongside the respiratory symptoms, fatigue and headaches were common. Fatigue, in fact, is the most common post-COVID syndrome symptom for many people. 4. You may have heart problems. Long COVID sufferers also reported heart symptoms such as palpitations or fast heartbeat, as well as pins and needles or numbness. Many of these patients usually have had no history of heart disease at any time in their lives. 5. You might have brain fog. Problems concentrating or brain fog is also another symptom of long COVID. A sizable number of patients have suffered from it at some point. It's important that, as well as worrying about excess deaths, we also need to consider those who will be affected by long COVID if we don't get the pandemic under control soon. So what should you do if you think you have long COVID? You should contact a medical professional immediately. Although there is no cure for the problem, doctors can try to help treat each individual symptom. In conclusion, no matter where you live, wear a face mask, social distance and avoid large crowds. It is wise to get vaccinated if the vaccine is available in your region. You have finally made it to the end of the video and I hope you learned a thing or two. Why not celebrate by subscribing to my channel? Please like the video as it helps others find this information too. You could also share it with your friends or family. Thank you for watching and see you next time.